Obviously, if you take contaminated water, you drink it, you can have waterborne, water-related diseases. We all see that infants, especially infant mortality is high in the Gambia, especially in the rural communities, because of the consumption of poor quality water, as well as we see that the issue of trachoma, access to, even to clean yourself, also sanitation, open defecation, all those things as well.
When you get to some of the communities, it's just pathetic to see where they get their source of water. And you look at the women and the young girls queuing for hours to be able to have just a gallon of water.
birin tolla keba folol e tolbe futala nan jawato minna iman kolon taraja e min taraja wolem woyoti ya moy woyo jiya min kabori akabol dinko koto kata kabori kata ba kono walla kata fara wulu mbang kono kebal folota wole soto la jang yo batal soto jang fafo because what monu iman londo soto fo komi say nga ni jamano nga londo soto ngamen ka kolongo si bare biring ila sio tata fa meta ina da londo ta ka soto kilin domandi fo ka kolongo si ka jio soto ji
jandi wo kolongo ni ka soto do bañuru kata e ka tama jambalo ke jandi ni pour ka jio soto ka samana suwo kono o ka tindano janta ka wato famu ke faro kono ko kenoji ka to ni na ta foita jiundi ko siman tabo ati wonde pula bolla
dolonga min tara na wulula lay ka subu kiti wala tay ya ja do man ya bula dimba kono do mandi yana ngoji ka siti ka ke fendi mi ana ka jibi na no ko ka ngoji comme problème balé because pour ka kodo so do ka julo san wala ka dol bula o bela ko eta yinke lim momo bita jibela na la julo so nin julo to te bulo e ma songo so do so wala na kan local fen ko ni tada
pot bon tol toratal atun sa ko den torat sa bonan faro ko na ngata fo bi hinja ko jena ko da ko dio man so mbate wonal se yayi fo alsa tara kolongo jat al sebata min doran di kasoto na ni na te yo gio sonso ya lundi mori nene tabiro man ko ya ka ni kolongo se wo yusu ko nyama min doran on kabatala
because kolongo dia ta man dia danko e gio so danko e te min doran dia mo bu ka wonyinin kanu sako senea mo buka hunyinin ka baake
ka jeel min bi wo kolongol to jeel ni aman jata kende ya soto baake jeenyi because mbuka jee bi na nga fajindi nka bi na nyami nka yusu wala nyam nka tabirol kala wala nyam nka mingala wala nyam fending ka mine ke je fonin ka son fa nka son diro mosa wala keno je don kaake bar ni ya jibe wojjiyo fana nawo soto kono sasa mesen jama ba kono sa kono jimi jama soto no jele ba kuran do soto la jeta malo because fenno kolongolo adabe yellinne
wato do ka soto ikaje wati killing sate kono dindimol be kono ke bay mol safo ko mod be dimba don la bamburango jalita bari satara wonte e wojjiole mol ka mummi katu kolonda kense wala feo fenku ba kuran ka tra fonyolo kono e bajala ko kuran kesolu wollo ka jolo wo kono ni kaje ko e tumbundi gol ka tra je mol ka fay ko jidi wo jiyo bu kan din sot yaje so wo jiyo ni e dol ka sonson ne dol bu ka sonson bari hali ya sonson fo se nobi so wo noni o kana ke mol ye kono bayoti bawo e ni sol fawna kende to ta kuran kesolo ka tra o bala so e bajala ko mol ka jiyo soto dabe mol ni beangol no ka tra denni wo kolongo jinna so e bajala ko tonya mol ka kuran keso ci kana woloto ka samanan ira sugol kono so wato jata kende ama sabati baki.
Well, obviously, if you take contaminated water, you drink it, you can have waterborne, water-related diseases. We all see that infants, especially infant mortality, is high in the Gambia, especially in the rural communities, because of the consumption of poor quality water, as well as we see that the issue of trachoma, access to, even to clean yourself, also sanitation, open defecation, all those things as well.
So ibajara ko wato wala na ni tata loptano to wati e ka loptano trafani sasa tolla ande jama ka ke kono bayolot so saya fana nata na siya dindi wala karola bawo e ni kono yi bay bake e kaje ko e ka fonji jama lay jato kono
comme atul to kare nol fan kafnya water is life jiyo wala mbalwota ala ni ji senear wo sonata wol dol be talala le
ate se dindin do ya se tulu fo be nimti lo kandita dorom ayela mone o be sabo jiyo ay gi kendo soto asame o asakesira yalo ndini wol be kasila ya jiyo tara damen doron dankate kono e fa.
When you get to some of the communities, it's just pathetic to see where they get their source of water. And you look at the women and the young girls queuing for hours to be able to have just a gallon of water. It's very pathetic, and you look at their source, it's unhygienic, especially in the CRR North and URR North. It's very pathetic, and some of them even use animals to draw water from the wells. It's really serious, and there is a need to intervene in those communities.
Ntol jang block sate kono sako nanyin karambongo kono jang jio la kuo nkabata ba soto je katun jio ala facility nyi ma wara bake ka soto le beren ka soto nyama ka kholiya bake le katun na gadi no soto janne bare jio nyi diningol kata ka binang pompo mialong han pompo mialong abe karambongo balaje bare kabata jama soto je katun ni sate molle denta
na gadi no man jeso ka findi ngata pompo do mol ka tara siare nyi ñu sabo na classe ko na fanan ka jeso da ka koleyale nin na da jambu ka jeso do nin da pompo do fanan ka so do fanan janne ka so da ka koleyale salji mu do fanan pour ya so do pour ya jeso do ya salji mu da aba koleyale ma baake
yo la so ni koleya kabiri nara nun jang batata baake ala yaalo ato kolon be jana fula ke dole wala kolon sinja katawol ta anu kolon ni fanu batale on na dinni wol jang bu ka haani woli ta jibi la je katare nga jiyo yoro na ñon mo kara do je ndorbe jibi la fa pour dinni wol fa be min nano jiyo min because amanse pour yeta e loye dulo ni saba fen kole e ka saba tenne polio ni nga jibi na ne a samana pato mo sobe mbuja kala koyo tin ka tale nga sonson na ake sijulo la sijulo na foi la sijulo samara nga jiyo keje ya cika ya sama pour ke min to ka dol so nga londi jam pour na tabir la anu ni fini tabirek la hani la ku bulu kuran jibe o mon tolle ke ma ko ke bulul ku jam ke la bulul ka sene ina si de moroke ni to nga jibe min ko somanda nga na manol ku nga na bagasul ku nim pare ta ko tek jannim be bolol kula nin dinwol to morta kamuru ne ba ko tek nga ta nga jiyobi na woto nga na nga bagasul ku fo sene ngana sama jolbi ngel londe pour sama ni nata so manna ni mol kana so bar dini woni nata han ten kami fo so manda do biye hani kamoto ni bita kana re kan dani jan jola fonga dila because ko ngome dana jam ko ngo fenki tale afano tale di no te jobi no laji
so mi atinna nka gadi no ke because food ka soto janne ika domoro ke janne so aba kono le nka min do ko yang jama bije aka murum pour dindingol la domoro la jang ni waño kono anin fanan ila itol fanan sa karang ya no gadi do ko be nyaamen sama ise fanna fano so nyinem koti mi atinna gadi no nka ke jang santamita hani na gadi no jang na fengol ngamin ki jang amuge fata femma sabu fojiyo so ani fen jama saliji muto jang tol ka salle jang jalimbe jira wo fanan wotu mon ka bata ba soto le dindingol waddo ni tara pombo do waddo e kanyo baramale so wo bebe batalle kono mi alo ngamin soto num
kunu e korda jamal bije kamatije mol ka finti bantolot andu banta finto jata kende atije kato niwo keno to tata fa jata dron fonyo ka fele aka murundina na suwol kono
ko bi non ta ko gata kamut ntola jang kamati jang gata salo diara ay ta koma kungu keno abita wada kamata kay nana naftar wotuma fan staff na kutiji ko sa tara wotuma mo experience ka fani mo kama be bulo kul staff no o be dum dañi karawato ko
wo keta mantora ko ballote way mol batandi bakele because wo fana yatinda hani wo jata kende aji ban sabati do kote
ande fon ko kelek mom te kam tay mu da kamoto so ko karam bali tol de crash nduk mal de ga kamoto ji o be munasum kamo mon soro mo la so ko na nyami bari ni banda ken total ni tata ji baro mu bandal di e sidano yakji samas nanu ani jiwa muda samba a samba dulal to teng a courant janja ni courant message ngol wala ka sap
jogal kër ga ma la doon jaayloo kër ga jar na
xam ne démb rek barki démb rek am na ku ma kool di ma laaj ndax jar na am de
waaw yow wutal ma client wutal la client xam naa client jaay naa ko kay wax dëgg yàlla sant yàlla la ba mbëri nag
waa jox ma suma wàll
junne ba ma xamee loon jël ko
balaa nga may junne nag
waaw
da ngay fay bor ba pare
man dama xameel kenn bor
amee loo kenn bor
mukk kan la amee bor
xamuloo kër googu ñuy wax jiyaare waaw
dama koy dégg
fi ñuy fayee taxi yeeg yooyu fi ñuy fayee naamo
dama koy dégg rek
mu ngoog dafa am nag ci biir taxi yi lu ñuy ooyee capital gains tax
muy capital gains tax
waaw kay capital gains tax boobu yow moom war nga koo fay fi mu nekk nii
man ma jaay kër ga xanaa ka ma ko jaayee koy fay kay
mu ngoog xam nga kan moo ko war a fay bu fekkee da nga am empty land boo xam ne yaa ko moomal sa bopp boo ko jaayee moo xam nu xaalis ba toll da nga cee war a génnee tax fay ko jaaree
dama ciy génne taxi
fay ko
muy bi maanaam li ma ko jaayee laay dank yëpp ñëw jox leen jaaree jël leen
déedéet doo ko defee noonu waaye dafa am pourcentage buñ ciy jël dafa des nag ci xaalis bi ni mu toll ñu génnee ci mun ngaa fay sax 5% wala 15%.
ma naa fay juróom
waaw
wala fukk ak juróom
waaw kay bu fekkee yow kenn la waaye bu fekkee compagnie moo ko jaay
waaw
moo xam kër gi empty land la
waaw
wala dafa am taax ci biir
waaw
bu fekkee compagnie ko jaay mun naa fay 10% wala sax 25%.
ma fay ji fukk wala fukk ak juróom
waaw bu fekkee compagnie
noonu la
loolu mooy capital gains tax te nag du laan rek ak yeneen yi mel ni moom yëpp te xam nga loolu fay ko li tax mu am solo dafay dimbale réew mi gis nga agriculture bi
waaw
njàngum xale yi
waaw
tali bi hospital bi yooyu yëpp dafa bokk ci loo xam ne government bi daf koo war a def nga gis ci sa bopp yow
léegi bi maanaam fu mu ne nii may waxee yow fii laa defee bëreet dootuma jaar kër ga de nii laay jaar dem jaar yi
yéen ñii di ma seetaan ak man mii di wax ak yéen daw leen gaaw ngeen fay seen capital gains tax ci makaani jaaree bu leen gën a jege ndax loolu mooy doole réew mi
Most times these communities, they don't have access because of the capital costs involved in having access to these improved systems. They rely on open wells and probably they cannot do much because of the capital costs involved in providing improved water supply systems. So mostly they have to approach the donors, governments, go to the area councils, the parliamentarians to contact the Department of Water Resources or the councils or the donors, NGOs, to help them because poor water quality, poor environmental conditions, poor hygiene affects your health. So this project will undoubtedly improve the lives of the people in the target communities as well as indirect benefits also to other communities.
What is usually done is that the community will request through the regional staffs, regional water motivators in the various regions in this country that they have acute water supply, or there is a report from the Ministry of Health there is actually prevalence of waterborne diseases in these communities, and also they have to meet the criteria of being able to maintain a minimum of $25,000 is in their account. And obviously there will be an assessment to verify all these claims that they are claiming from this community or report coming from these partner institutions like the Ministry of Health, talking about the prevalence of waterborne diseases in these communities.
Kamira no baki sate oto jang ni alkalo ji senu gon tolbe o soto no la jadi do jakalo lo kono lunkilin do water resources findita nankan ko block fanan altol fanan ala yala harje bo holola wo kontano nata waral fe bake wo dalilo kammal nata na sate o be kumande kayta dila ko ala harje bo holola
kabri CSRS nata yemmol kumandi sate ko dara alkaloya sate be nata je ko ila fekk mol ma ko bo holola bar bo holo nyin ala e nyanta ko mol ma ko ala nyamen ye wala explain tarta nun ko wala kacaje folo e ko e tolbe ndol sate mol be ngamra 25% ndolbe wala kala because ngawo contribution o kala already fo nga alandi bank because iko de amount lebe yemi alon ka tu sate mol nyanta ko wala sotoni nali o sotondi ale o landi bank pour in case nala bo holo problem soto e saje ibo comme ni handing over ka already nala bo holo problem soto o moni al bol tala rek alia do ko nga 25,000 sleke bank because ye wala fo mole nga wala contribute fo nga wala di bank as pour wo be tarla jele pour fankanto kamba any problem rek jannim be nyo batan la wala se wota nga solve but still ko do nyimbe jele.
So we have to make sure that the communities are committed. It's not a large amount, but we ask them to put in something aside, because if we are providing the improved systems, the solar systems, for the first 5 years you don't experience much problems. But after a while, you have to do some kind of maintenance of the systems.
For water infrastructures, we are going to provide 144 water points. That is, when I talk about the water point that we'll talk about, we will have a borehole, the reticulation system, that's the pipe network, the storage tank, and the pipe distribution, where you can access water through the tap. We are providing that. And the number of communities that are going to benefit is about 209. And why do I say 209? Because we are clustering many communities. Sometimes we cluster the close communities within a proximity of 1.5 kilometers, rather than giving them individual systems.
And what we try to do at the Ministry of Fisheries and Water Resources is to also, we help to train the local artisans or local workers in the community so that they can do simple maintenance of their systems. If they have plumbers, they don't have to contact people from outside. So we offer some kind of training, capacity building of the beneficiaries so that they will be able to do simple maintenance and operation of their systems. So we encourage them to participate in the maintenance of these systems, select their own people, because this is a project, it closes and we're gone. So they have to be able to take care of those facilities.
Pompo ni nata de maro la mansakundala ko. Mansakundala de mar pompo lo. E kamin di sate wala santo. Para kabrim pompo ni nata. E nata ngi ne suggest brim pompo lo ta ko. bawo jiyo ita bila no tanko kuran wala ba sambal andun kuran wala wo sambo fenne ka ke jeedo min be kuran sambal say ni wo man soto yalon pompo titala wo kammala nata ngin dala soni wala ngin dala soni nata si VDC ya juwi anin sate mulko mom woni atare be jiyo bila pompo to ni dala soni wo dala so han kabi fango wo ben na faala min kam man say kuran soto no be jiyo bila ngin dala soni min kam anin sate wala sula kodo nyi min ka tarje wo dala sul na joda karifa ya kolek pompo do ya landi ni pompo e problem wo soto wo kodo kadu wala kun
kato wonata na sonia ndi baloke e haninda fankot la soto bulot bawo kuno e nillo ko wollo ko e kata loptanot fennante fokkono bayo bi e katraje sanji mumi kono bay be mot e fa kodo mun tanu kata loptanot ido kodo tala yeba do ndira haaji do non
aha wo keta mole kontaan ko de kabina rek pompo yele bol kontaan tale nge welcome ni kacata nga kuolke nga yatandi molla pompo nyanta yusla nyaadile andu nyanta ka tekya nyaadile nyanta ka operate nyaadile yow de explain moli so say pompo ni mbata amandi kanne abita kan alhamdulillah no problem
andu project oji fana yen dandalale ko ni jiyo mo pour ni do damalo tani tabiro beya minditije amake pour beya wala bindulati hani ata ibe kuro keraje ibe muflane 10 meters ini pompo tema 10 meters no janta tallaje ibe kuro ni kala dane fendante pour no kana muruna e wolki bi dane andu dindi mo bu yalo ka man sanji tan soto bu ko fanam bula pray ta pompo bawo o dindi wonu bu ka pompo ni trande foy sele pompo ni na tabulo kan ka pompo ni yele ibaje la ko kono dindi ko ni fay o jiyo ni nonni fo jiyo ni se no soto ka bo sanji tan kata wo sando wonno kati ni ha ni pompo la nadal ay jata kende a sabati ndi sato kono ani molla fanko fanan yurwata kotek molla soto buloni yurwata
biri ni demaro nata a biri demaro murunta na molka biri nga jiyo soto man ko la yakuji je foli sendeng alhamdulillah nga jiyo soto kende
na gari noto ka jiyo soto jang anata sonia bulu bake ka jibondiro kele kon lafta la nyamen buka bata soto je.
As we all know, we don't only consume water for domestic purposes, we also consume water for agriculture, for industries. Whatever we do, starting from our homes, in offices, in the overall development, you cannot have development without water. And also the impact of this project is related not only to health, but to education as well. Because girls spend a lot of time, and women, collecting water from these facilities or having to travel if they don't have access to long distances. So it affects their education. So if this project will also not only help, but it will also have a positive impact on education of girls, and also provide additional time for women to look for other income generating activities. They will have time to do a lot of things.
Nyimbo holo fanan anin bunda lolo nata nyola mun keta kamoldi ye kamolu londi karambugol to ani ye kamoldi molla satewol kono mu yalon ko e jarta pour ka kamo soto kamolte bulu bulu
bari ya kanya dile momo ni tata kamoto ye fango nafa ye kamo ka foy pareta ni finta nan jeni safunola eke bloku wala rek yetaje so wo fana na jara kende asabatin.
We know that open pits, open latrines are not hygienic, and they can cause a disease with flies flying around and then coming back to your food, especially kids. Kids have been exposed a lot to these open latrines. It can even be hazardous and deadly for kids can crawl into these open pits. So these ones that we are providing, they call the Gambia Improved Pits for the households, designed by community development. So it has greatly improved the access in many of the communities. And I think women especially, they appreciate and accept the design that is provided compared to the others. We've seen in the previous project that some communities, those who have not been provided, were building their own when they saw their neighbors have the privacy. And also, especially for women, it creates this privacy. They don't have to go to the bush, which is called open defecation. And as of now, I think UNICEF too is involved in this, and together with the Ministry of Health and WHO. So we are all working towards contributing to improving access to sanitation as well. Most water projects come, but they don't include sanitation, and that defeats the purpose. If you don't also try to improve sanitation and water hygiene, they interrelated somehow. We're still also looking for maybe improved systems as well, because of the lack of access to water in most of these communities. They cannot have the systems that you can readily, have water, the wet system. So that is why we're providing dry pits, but we're also including the hand washing facility outside those public latrines. Even at household level, they're now creating simple kits that you can use, materials and for hand washing. We also provide trainings for hygiene promotion and education, especially during this COVID. We provide them with that kind of training and the management of the sanitary facilities. We don't only provide water, but we also provide sanitary facilities, hygiene, latrines in households and public latrines, in markets, open markets, places of worship, as well as in health facilities that don't have sanitary facilities.
To sensitize them on behavioral change. Yes, you can sensitize them on behavioral change, but the facility has to be there. Yeah, you cannot tell me stop going to the bush and I don't have a toilet at home. I don't have a toilet at the public place. I don't even have water. Before I think of washing my hands, I must have enough water to cook and to drink.
Koran, ado.
Sorry.
Koran.
Sumon.
Ina mori. Ne korda wa. Ne profit sorry. Inyente na la yele na mo jojang.
Ya.
Ala na mo profit nyim. Kemo nyane tanni lulu nyanda wala jola jiare jang.
Ila keno me mula keno ya wa fe na mo jo fana kun.
Hako.
Mbo mo la.
Ade me mo la de.
Ha.
Yare de man reja.
Musa ya la keno la korda la wafi. Ala korda la wafi aka wala foyo ko anata wala jojang capital game tax to jang. Anata wala jojang de kemi wo kemi sir la tang ani lulu ayanta wala jola
ila profit
momo nialon ko e ka korda la wafi walla korda lore mbandi ko ka wala wafi ite nyanta nyin capital game tax jola jiare le
compagnie
ni atala dum fanan ibe compagnie le kono compagnie ye siyaso do je walla ye mandin kol ka fa mu ye ko niyo be je le compagnie nyin kono so ite nyanta munekela se kemi wo kemi sir la tang ala fanna do bi je bo re jola ala fanna do bije kemo keme sidula muwan ani lulu ibo la jola adi bo jola min dola wala mun capital game tax to diare nyanta jola wala ko fe man na yin jata ken ya bundal na yin karamol nin ku katol be ka bonin namo ko aku jama ba ma ka bonin namo ko
amanda wala bakari nanyen stilo men niti nyata ana mo ka kataji yele
mbajule ko mbaju jende malam bang fo mun to
Gambia da
da hondu bi ajula mun to
diare la office be dawo da ni refutata je ibon nata capital game tax le jo damo nata wala jo ibajola
abaraka nyalo bidu abaraka maraw
inda de ko nyaw ko maraw
yo bismillah okay abaraka
min sala fo mbajule
yo bismillah abaraka yo musa bidu badi molu al signal lonko banku di wo banku di ni atare ikata banku di tuwe manke banku di tuwo adi ka kenolo wafi wale ka kordala wafi ni ya wafi mun kuma ta je wala ta diare la capital game taxi to yeta yete la namojo
We're targeting about 140 communities, that is having 140 systems and 4 systems in peri-urban communities. But in total, those are the project facilities that we are going to provide, but the actual communities will be more than that, more than 200, because we're going to cluster some of the smaller communities sharing systems.
Some of the identified villages during the preparatory and the appraisal, recently some of the communities have benefited from other donors. So there is a need to replace those communities. So obviously if another donor has provided water, you cannot go and provide the same water point. So who will manage these 2 water points? So there will be duplication of effort. Rather than putting the water supply there, you move it to a community that is not having.
Sanitation in this country has a lot of also, I should say, cultural aspects. The way people view latrines, use latrines, and it differs. You know, when you build a house, some people are not bothered about the latrine itself, where especially in some communities in the rural areas, it used to be in Banjul that latrines are outside of their houses, way away from the main house. So it's like, it's private, and you know, there are a lot of cultural aspects in sanitation. So, but I think Ministry of Health, through the health promotion units, they're doing a lot of sensitization. That is why our project, they are actually supporting us in implementing that component. This is an integrated project. It is being executed by the Ministry of Fisheries and Water Resources, but it's not an isolated project. It's in partnership with the Ministry of Health, with the Community Development, the National Environment Agency, because it involves a lot of environmental management. All of these projects, you have to carry out an environmental and social management monitoring. So National Environment Agency is a partner in this project. We're dealing with the councils as well. We want to be involved in waste management with the Kanifing Municipal Council as well as the Birkama Area Council. So it's an integrated and multi-institutional projects. We have a lot of partners that we are dealing with. We have a National Steering Committee. We have a technical committee comprising of different members from different institutions that are helping us to achieve the objectives of the project. And we also have a team of different experts within the project who are able to help in the technical aspects. They are called technical assistants. And they are also working closely with other institutions.
This is it's an integrated water project. So we have the Ministry of Finance that endorses, that signs the grant with the donor, and also sign our disbursement and replenishment forms for us to be able to withdraw the money from the bank. And we also have the Ministry of Education, because we are intervening in schools and also piloting drip education. So the Ministry of Education, through the basic cycle, is involved in this project. The Ministry of Local Government, through the Department of Community Development, will supervise the sanitation hardware component, that is the construction of household latrine and the supervision of the public latrines, and also involved in CLTS, that is community-led total sanitation. We also have the NEA, the National Environment Agency, that is also involved in as much as we are bringing development, we also have to ensure that we comply with the environmental regulations. So they will be monitoring the environmental aspect of the project, which we call ESMP, Environmental Social Management Plan, and the Ministry of Fisheries and Water Resources as the execution agency for the Ministry of Fisheries and Water Resources, and the Department of Water Resources as one of the implementing partners. So the role of the Department of Water Resources obviously is the supervision of the implementation of the water infrastructure. Currently, they are the ones supervising the borehole drilling to ensure that the contractor adhere to the specifications. and they also help in the tap allocation and anything related to water.
So when we did our planning, we realized when we went back, because it takes a while, you know, when you are dealing with donors, the preparatory phase and implementation. So when we went back to implement, we realized that other donors are have already provided such systems. So the communities are all out looking for improved systems. Climate Smart Rural Development Project. It is a multi-donor funded project by the African Development Bank. Also co-funding is from the Rural Water Supply and Trust Fund, which is an African initiative by some European countries for the whole of Africa. So we also got funding from the Fragile States Fund, from the African Development Bank, the Global Climate Fund, and GEF, Global Environmental Fund, because it's environmentally related, as well as we're expecting from the Adaptation Fund. So the total cost of the project is about $40 million, but so far we've only been able to secure about $20 million. But we're getting support from the African Development Bank and the government through the Ministry of Finance to help us mobilize additional resources to be able to achieve the overall project goal. The project has been designed to absorb that amount of money. So we already have the activities in place. At the moment, we're implementing the activities that we have funds provided for. So we're not waiting for the other resources. We are making all plans. As soon as we receive them, we will be able to implement the other activities.
Yeah, the implementation of the project right now, like you know, we have been hit by the pandemic. But on all these components, we accept where we don't have, we are yet to receive funding. All of them are moving in the right direction. When you look at the water and sanitation component, the borehole drilling have started, and we have drilled up over 10 boreholes in our project intervention sites. We have also signed the contract for the network design and supervision that will provide technical document to show how the network is supposed to look like and provide enough data for the capacity of the water supply. And in the area of sanitation, we have actually prepared documents such as the landfill study document to design a landfill where we will construct a landfill, and also the waste management design studies is also underway, the procurement. So all these procurements are at advanced stage in terms of recruitment of the contractors and consultants. When you come to the capacity building, the partners have been trained, and also the communities have been established. There is plan to train them on the management of the water facility or the wash infrastructures.
The primary challenge of providing these water systems is the issue of sustainability. Operation and maintenance of the water systems is of particular importance. That is why in all the provision of the water systems, the planning is important. You have to engage the communities. The sense of ownership is very important. They have to know that this is our system, we have to maintain it. And some communities have been managing their system for more than 20 years in this country. They know the importance and the value of water. Because you can have, hygienic water systems, but that has an effect on your health. So I think they have to make sure that they plan well, involved in the planning, in the maintenance, and also in the operation of the system. It has three objectives, key objectives. The first objective is to improve access by providing infrastructure to the beneficiary communities. That is about 140 communities in rural Gambia, as well as 4 peri-urban communities. And the second objective is to improve the capacity of the beneficiaries at both national and regional level. And we're also trying to improve the livelihoods of beneficiaries of the project, particularly for youth and women, and trying to improve their capacity in terms of managing the water resources as well as managing waste, because these communities are vulnerable communities exposed to climate change conditions as well as poor environmental management.
We are contributing to the NDP 4, Pillar 4, and also to, when it comes to the SDGs, we are contributing to SDG 6, that is water and sanitation for all.
Providing improved water supply and improved sanitation, hygiene practices. We expect that all those things will have an impact in the overall lives of the communities and the beneficiaries in the Gambia. This project cannot do it all. We're just contributing, and we hope that other projects will also come, and government as well is doing its part to help to contribute to the universal access to all for regarding water, sanitation. All these are basic human rights, and also improve we hope that by the end of the project, the community's hygienic practices will be improved, both in the rural and the urban, peri-urban communities that we'll be working in. And we'll try as much as possible, together with our consultants and partners, to achieve the overall goal of the project.
WHO standardized measures on COVID-19. I've just mentioned one of them, which is the proper hand washing, and following all the steps that are involved in proper hand washing, and also making sure that when you are going out on public outdoors, you put on your proper face mask. And when we say proper face mask, also, it's not putting on a mask and then putting it under your nose, or putting on a mask and putting it on one side of your ear. And these are all not proper ways of putting on masks. But when we say proper face masking, means the face mask should cover your nose, your mouth, and your chin. Everything should be covered, so people should understand that. And we also have to make sure that when we have the opportunity to take the vaccine, we should take it. It's also a preventive measure, which is also recommended by WHO, that all adults from the age of 18 and above, should try to make sure that they get vaccinated to be fully prevented. But also, not forgetting the hand washing, the face masking, the physical distancing, avoiding of crowds. These are all measures that are recommended by WHO, so that we will cut the chain of transmission of the virus, which spreads from person to person. Before we were talking about other strains, but today we are talking about the Indian strain, which is also, fast approaching to many countries, all due to the people not following the proper, standardized preventive measures that are set to prevent the people from the transmission of the virus.
di wor korite soo déggee olof koor ak kori koor mooy nga dugg ci di abstention bi korite mooy nga jóge ci or woor bi dafa explain boppam mu ne bi nga jóge ci or ex naka li nga suspenoon ci sa yu yi daan entertainer sa boppa yëpp léegi bi nga jóge ci or lam la aaye woon ci biir période boobu remind nan la sa diggante yàlla lan la yàlla soxla ngay def yow ci sa bopp fàttaliku nga ne alhamdulilah yàlla bette na la nga dunda ba fekk weeri koor nga mun a wax sa bopp ne maa ngi rëccu ñaaw bi ma def yàlla balal ma loolu mooy weeri koor nga baalu koor mooy abstention nga abstain from worldly entertainment yëpp da nga koo bàyyi.
soo bàyyee Ramadan sa dëkk bi woor bi daf dee change ñëpp di amante yërmande ñëpp dee nekk si lu santaane yàlla xam nga ñëpp dee toppa sariya xam nga ñëpp dee try pour def luy please yàlla xam nga loolu yëpp pour yàlla ñoo may ne ñun nii war a dundee suñu life as a muslim dem convoy ci jumaa bu mag bi pour leen def convoy muslim si yëpp toog imam bi di ñëw bala moo ñëwul wata ko nit dañ nekk di sikar ak am na ko di sikar nit di aw di sikar la ilaha illallah nit di aw imam bu ñëwee taxaw ñu julli korite mu xutba ñaan si yàlla nanguñu suñuy or boo dasin di morning
sa mudd koor mooy gi nga di li la yàlla may yëpp ci jamono bi nga dunda li la yàlla may ci àddina yëpp xam nga ko daf la war nga génne ci jokko di po that day bëgguñ kenn yalwaan bëgguñ kenn ask for anything. Everybody should have something to live on and to be part of the celebrations. Doo yalwaani doo ñaani doo dem di look around no.
di sant yàlla rek comme que fekkee nañ ko ren di ñaan yàlla mooy ñu fekkee ko at yu bëree bëri.
waaw weeri koor moom ku ko xam ne weeri koor yombut waaye tam weer bu jafe la ndik fekkee ko rek doy na jaamu yàlla.
This time around is a little bit better than last year because beyond at least sant yàlla comme que yàlla nge wàññi Covid bi wala daanaka jeex na fi ñu ngi ko sante yàlla di ñaan rek yal na ko yàlla dàq si àdduna si incha allah ba nga xam ne du fi amati.
ndax daaw kenn mënut a ñëw ku nekk a ngi xalaat sa bopp ren yàlla yomb na yàlla ñu ko yàlla doole yombalal ñu ngi ko ñaan rek yàlla ñu daaxal feebar bi.
waaw fu mu nekk delluwaat si kër la jaama sante dem ziyaare wante yokka jaama bi diggante am di jaama yi ak diggante famille bi ak ku nekk ak sa soppeek ku la yàlla booleel.
tey lu ñu añee nag tey soo ko seetloo ganaar la war a ndawal waaw boo si cuus rek parce que tey dañoo añ amul ñoo or añ la rek dem rek.
benn ci dina amee boor bi pour jóowee nii ba pare ñu tegee soos bi boor ba leen ne pour njaayee nii ko defee ñu uti ko seet kanaay mun sa morom incha allah.
At the end of the Eid al-Fitr prayers here in Banjul, Muslims return home to their families to enjoy the meals prepared by their mothers, sisters, aunties, and others to start the Korité celebration.
I am ganar ak vermicelle.
Loolu nga toogate.
Waaw.
So yéen lii da ngeen ko dee tooga every Korité ngeen dee tooga lii ndax.
waaw every Korité nañ ko dee tooga.
lu tax ngeen ko dee tooga every Korité dafa neex.
waaw dafa neex parce que lu fa dee dem yëpp la.
so loolu yëpp moo dem si biir.
waaw dafa dem si biir tooga bi.
ok so loolu pour tooga lan la.
lii pour décoration bi la.
lii mooy lan.
lii mooy vermicelle bi. waaw diwlin lañ fa dem ni pour ñu tay ko.
so bi toogaa nga.
déedéet bi pare nga.
ok so léegi ñu dem si ganaar bi maa ngi gis ganaar bi lu koy dañuy baax naa si am.
waa di nga si am. waaw.
so wax ñu dara si ganaar bi nag ñu ngi gis ganaar bi mu ngi am xaw ma mariné xaw ma ñu.
waaw dañ ko mariné ba pare teg ko tay ko léegi dañ ko ñoo lakase.
ok dañ ko grill.
waaw.
ok man dama ko ne nii rek la moo nii rek.
déedéet dañ ko grill suñ paree.
lu tax nga koo grill.
déedéet buñ ko fry diwlin bi moo tax ñu koo lakka.
so after tooga bi yëpp lan mooy happen tey.
suñ paree dañoo yekka. waaw
ko yekkal.
dañoo yekkal goro yi njëkke yi maam yi papa yi.
ok kii moom suma jarbaat la moom tam mi si waañ bi mu ngi tudd Daga Fall waaye dafa mel ni yow sax da nga mun frej pomme de terre Daga yaa ngi sawar si affaire bi de.
because lii dem ko jàngat bi time xale.
depuis nga nekkee xale.
waaw
loo ko jàngal sa toom ak sa yaay.
suma toom ak suma yaay.
ñëpp ñoo la ko jàng.
waaw.
Daga sax nii si nees na yaa ngi pareel Korité bi de
waaw kay.
gis naa daal tey daal moom waañ baa ngi busy tey ku nekk mi ngi busy si waañ bi di defar.
waaw xam nga si julli leen nekk.
soo léegi pomme de terre lan ngay frej nii.
pomme de terre ak soble la frej naa soble ba pare.
léegi seen pare dinañ ko defar na.
dañ koy baxal ak neen suñ paree.
waaw.
ñu lii ko ñu def ko mashed potato.
ok after
ñu joxe nit ñu lekk ko.
ba suur.
waaw kay.
yaakaar naa ko wér ko bi jeex de.
yàkkamti naa kay.
so affaire yi moo nekk loolu daal gars yi si ko am daal léegi fi nekk nii gars yi ñu ngi tooga léegi gars yi pareeguñ so for the time being lu dee xew mooy dama dem suma boy yi dem toog foofu noonu waxtaan ak gars yi chill xam nga enjoy korité bi xam nga because ñun duñ dee mën a am loolu time korité because time bi ñu fekk ñëpp a ngay nelaw ba ñu mën a eewu ay 6 5 xam nga waaye comme fu nekk korité weeru koor bi jeex na dañ mën a eewu suba sa dallu xam nga dem toog waxtaan na ataaya yu noonu waaw xam naa fii balaa ngoon fekk añ bi pare ñu ñëwaat kër dallu waaw ñëw añ chill toog gaare
loolu bi jeex na léegi fi toll nii añ de woo reer ci kattan yàlla rek incha allah. yal nañ ko fekkee at yu bari. yàlla ka. ñeex na trop. ñeex na trop.
bu njëkk actually dafa amoon na fu am during the day after the from after Maghrib prayers or Safa prayers jeex na that's the end of Korité day ñu nag baan seegi daftaan amay boobu moom after fu paa yi em ñun ñu continuer ñun ndaw yi
In the evening, after enjoying the lunch, children visit friends and engage the streets of Banjul, asking for money, a tradition in existence for ages now. In the local dialect, Salibo, children converge at the Arch 22 to have fun to add up the celebration. The night comes with a different ambience of drumming and dancing. This happens late in the evening. Women come together in groups and dance in different forms to close up the Korité celebration. In a nutshell, this is how Banjulians celebrate Korité here in Banjul. Everyone goes to bed tired with a memory of a well-spent Korité.